Over to you, sir.
Thank you very much. I'm indeed very privileged and in the company of Honorable Chief Minister. My first thank goes to Shriram, thinking of me, and Mr. Tucker and the GS Global Forum. It's an exciting opportunity, and whatever I have seen is really a privilege. And I've been asked to talk about how we can leverage technologies for governance. And I'd like to start with something very simple. I think one of the major recent stories of governance has been something called Aadhaar. And the Digitech that we keep hearing about. But I had a very small question. 2006, the government asked me to consider creating a possibility of how to ensure that our Manrega people, their wages were given to them and not siphoned off. 2006. And I created a framework which is very simple, which could be done very quickly, but it was so simple nobody wanted it. But that was part of governance. 2009, my good friend Nilekani, he decided to do something became Aadhaar. But there is an idea of, many major things. If you get into complexity, what happens is that we miss out the essence of it. So if I had to look at Aadhaar, I said I learned an idea about smell test, touch test, any test, simple test. A simple test was, do you remember your Aadhaar number? Let me ask you, how many people here sitting here, you remember your Aadhaar number? Raise hands, please. Well, I see about 5, 6, 7. But in an audience of few hundred people, if 6, 7 remember the Aadhaar number, what does it say about it? How many remember their telephone number, cell phone number? Hands, please. How many remember cell phone number? Probably everyone remembers cell phone number. So point is, if Aadhaar is going to be a foundation of my governance process, should it not be as simple as a cell phone number? And that simplicity is very, very critical to creating any governance paradigm, you can say, or any framework. And somehow we miss out on that, the simplicity, how technologies can help us make things simple. Now when things become simple, I call them cell phone of anything. You want to create a simple solution? Cell phone or something. I go back in 1985, and I'm looking at a meeting with the Minister of Telecom and the government. They said if they wanted to give every citizen, and then we were 45 crore Indians, which means we were about, say, 45 crores, 10 crore families. If you want to give phone to every house, it will be 2,100 and probably will not be there. Technology changed. In 1995, November, some date, cell phone comes to India. In 5 years, nearly everyone has access to phone. Every family who could think of it had access to phone. What happened? Technology was made simple to the point that everyone could have it. And the government did nothing about it. Government did not have to do it. So one of the programs today in the world where everyone has access to a cell phone, they don't have water. They don't have potable water. They don't have drinking water, but they have cell phone. So what happened? Because taking water to the person or to a hamlet, to a house is not easy. But cell phone became so simple, it was possible. So the question is, how do I make technology so simple that governance becomes simpler? So just a test was, if I can remember my Aadhaar number or social security number, which every American does, because they are the originators of social security system. If you look at it from the same point of view, and I'm trying to urge you to see the notion of simplicity in governance. Now think of it, all the programs, when I look at our own evolution, we are a 75-year-old society. In 75 years, we have gone from $50, the richest economy in Asia, in 1947, richest economy in Asia. We have gone from there to become an economy of $2,400 per capita while Korea has gone to $50,000 and China $20,000. We began the same way. In 1947, we began the same way. India was about $52, China was 47, Korea was 48, and today, India is at $2,400, Korea at 50,000, China at 20,000. That's our journey. What happened? I'll try to share with you. It basically is a matter of governance. What happened? We were the pioneers of planning. 1950s and 60s. Korea began 62, 10 years later. But they began differently. We began the same journey, but by the time it becomes 1981, Korea has gone to $1,000, we were still at 130, 40, 50. So what was happening? So point is, if you look at the planning itself, the way we plan becomes very critical to the process. If you plan in a very, a different kind of arch, you will find different kind of results. Today, we haven't achieved the goals of first plan. That's a very interesting story. While Korea had learned from us, they came to learn planning from India. They began planning 10 years after India, and they became so successful that they began having a company of $40 billion in 1990, when India's biggest company was hardly $2 billion in revenue. So how did that happen? So when it comes to governance, I think simplicity is very important. It should be, look at, is it good for the last person? Who is the last person? When I look at our data for India, by the time you reach 2 lakh rupees per capita income, which is the average income, you're already touching 2%. 98% earn less than that. So I would say, how do you look at the GDP? GDP should be seen, not GDP per capita. One of my friends said, maybe let's call it median. My point will be, you're trying to raise zero poverty will happen when the last person has no poverty. So look at the last 10%. What is the GDP per capita in the last 10%, for instance? These are the questions which we have to go on asking. Can technology help us in that? Now let's look at how we look at it. In the US, in 50 years, there are a dozen entrepreneurs who created companies which are bigger than India. In 50 years, a dozen entrepreneurs create companies which are bigger than Indian market value. How does it happen? A person who began a journey in America 27 years back is the richest man in the world. He came to America from South Africa via Canada. Today he's the richest man in the world. How did that happen? So in other words, it's possible today, if we imagine, to create an ecosystem where a single person can create an economy as big as India's. Microsoft, Apple, Google, we all know these names. But it never occurs to us that these companies were founded by single individuals. And they created that level of market value, which is possible by India too. Then think of this way. California is a 40 billion people economy. Andhra is 55 billion people economy. California is 4 trillion economy. Andhra is $200 billion economy. The gap is about 40 times. US-India gap is about 35 times. But remember another thing. There are 50 million people of Indian origin outside of India. They earn as much as India does. 50 million Indians earn about $3.5 trillion outside of India, which 1,500 million Indians do it here. They have similar, what is changing is not, they are not changed, their ecosystem changes. What we are doing is, we are not changing the ecosystem. If you change the ecosystem, it changes productivity, it changes us. How do you change the ecosystem? Change the possibility of you becoming what you want to become. That is missing for 90% people. When we create a society where every child has the potential or possibility to become what the child wants to become, not what parents want them to become, child wants to become, that society becomes a very different society. So in governance, we haven't looked at these questions. We have looked at questions which are essentially either very high-end, remove poverty. Remove poverty doesn't remove poverty. Hasn't done in 75 years. Literacy by 1960, nothing happened. But literacy you are talking about, literacy means nothing. If I know ABCD, am I very capable? No. Similarly, when it comes to education, what do? It's not ABCD, it's not one thing or the other. What is education? I'll give an example. My son was 7 years old, and he said something interesting. He didn't want to go to school. I said, what happened? Well, I don't want to go to school today. I don't feel good. I said, okay. So why won't you go to school? He says, who wants to go to school? I said, how about learning? He said, who learns at school? I said, what? What do you do at school? I said, we get educated at school. I said, what is that? Education is what teacher wants me to learn. Education is what you want me to learn. What's learning? What I want to learn. That difference made all the difference of education and learning. We never thought of it. So in the US system, the effort was, what does the child want to learn? In our system, effort was, what do we want them to learn? You know, we had a good friend called Kapil Sibal. He became Minister of Education. Fareed Zakaria, and we were sitting in New York. He was talking about education. He said, what's the future for India? Kapil was very open about it. He said, I want skilling in India. My challenge was this. Skilling is not going to create a great society. Skilling will create people who can do here and now a job. But learning will create something which will create society. So we had the potential to be great. So should we become great, or should we become what we are here and now person, here and now society? And that's a big challenge. So I went to about several states, spoke to chief ministers. Many accepted my ideas. But things will come down to, but my education minister doesn't accept what you say. I said, well, that's a big problem. But easy running it's not a central subject. You take your call. But they will say, I'll say one laptop per child, and they will buy a laptop. Laptop was just one means. As a CIO of Roche at one time, I learned one thing. When I said technology in India, they said PC, desktop. When I said technology in America, they said, well, that's only 6%, 7% of my cost. Ecosystem. So technology is not a piece, it's a complete ecosystem. And we become productive in ecosystem. So my submission is this. Simplicity in understanding something that the last person can understand takes us much farther than making it complex. A cell phone number that you can remember, if that becomes Aadhaar, that tells us the way we think about society. That helps us, create great society. Same thing happens to all Indians who go out. Without doing anything great, they become part of an ecosystem, they contribute a great deal more. So we have to think of ecosystem. And I'm very happy to hear very powerful words: global, sustainable, transformation, and ecosystem. So ecosystem is what's critical, because otherwise it's like throwing seeds which will never grow. So you create ecosystem for that, and you have a farming. So my point will be this. I flew from Boston. I think I'm a little jet lagged. And this is a little too hard on me at this point in time. But the point is, ecosystem was the most interesting word I heard here, that we're talking about that. It was not being talked about 10 years ago. It was just one project, one task, something. So when you create ecosystem which has sustainability built into it, that is something is going to help us become a great nation, which can help Andhra have $100,000 per capita income 25 years. When I look at Korea did this. And Korea and our population of Andhra and Korea are about the same. Korea's economy already, I think, more than $1 trillion. $50,000 per capita. I think their population is about 50 million, so about $2.5 trillion economy. We can be too. We can be in less than 25 years. They achieved that in about 25 years. If you see the rate of growth, it's 3 times per decade. Ours was 50% per decade, except for the decade of 2001 to 10, when we grew up 3 times, we have been doing 50% every decade. So we can do 3 times a decade. And I think in 20 years, Andhra can plan to be a $100,000 per capita income economy if you really choose that way. That's a possibility. But beginning has to be made like China did. What did China do, what we didn't do? 71, when Nixon and Kissinger come to China, they start a new journey. In China, per capita income in 1971 was the same as India's, $191. And 2001, which is about, 1991, we were about 393 or thereabouts. But 92, China gets past India, and since then, it's been kind of galloping. Today, it's about $20,000. We are at $2,450 or thereabouts. So China did something interesting. It planned for 20 years for human development, people development, and that did it. Korea did the same thing differently. Korea says every single Korean, more than 21, is a graduate. No other country can claim that. That's what takes $50,000. So I would say that great societies just take some basic things about society very, very seriously, which is respecting their citizens and making sure that they can find their dreams, they can live it, they can create it. That's what it's all about. In America, pursuit of happiness was very important. So they allowed everyone to achieve what they want to achieve. They created a system for that. And that's what made America great. It went past Europe. Since 1945, 90% of Nobel Prizes go to people in America. They may be American, they may be foreigners in America, but Europe's basically lost out, America began gaining. The reason was the same. The reason was they focused on people, and they said, we will help everyone achieve their dream. My submission will be that the greatest programs we have had, they have not been government programs. Cell phone was a program not run by government. Technology and support. Don't do it. Doing has never, I have analyzed about 100 programs of government. Not one of them achieved the goals. Our people are best. Our bureaucrats are amazing. Our leaders are amazing. I can't get a single vote, and they can get billions of votes. I was not part of civil services, and I've seen them, how brilliant they are. But when it comes to achieving things, something is missing. What is that? Because there is something missing, and my submission is, what's missing is, we become busy with our today. We don't think of tomorrow. We don't think of 20 years hence. So good thing is, we are thinking 2047. That's a great thing. So a lot of great things are already happening here. 2047, global sustainability, transformation, ecosystem. These are all great things. But unless you bring it down to ensuring that every single citizen is empowered from childhood onwards to achieve the dreams they have. My programs here, we support you to learn at the frontiers of your aspirations. We say, don't teach, let them learn. So teaching, learning and education difference, that's very, very important to understand that when we learn, सीखो, पढ़ो, सीखो, पढ़ो. पढ़ने से कुछ नहीं होता. If I see a film, I can't make a film. But learning is about, can you make the film that you're watching? If you learn at that level, that's when you become great society, and that's when you become $100,000 per capita income society. So I would say that from a governance point of view, let's make it, and Honorable CM has said that, people-centric. So the last person is very, very important to me. Let's look at the GDP per capita becoming per capita of the last 10%, not the whole society as such. Median can be a reasonable number, but even better is the last 10%. So I would say that whenever you can think of creating any program, think of the simplest metrics that can take you to measure it better from people's point of view. In technology, I would say I had the privilege of doing about 45 companies, either investor or chairman or CEO or advisor, whatever. And I've seen every single company. I did my part exactly on time. But the founders were the one who drove it. And the idea is a company is done by the founders. What was missing when I do something here, when I do something overseas, is that basically they're looking at a complete ecosystem. Here we are doing bits and pieces. So from bits and pieces to ecosystem, that makes a huge difference. And by the way, billion is a big number. It's a very small number. It's a big number. It's not easy to do. But the people 21-year-old, they become billion. I've seen 29-year-old billionaires, 30 years. My son at 31, 32, he came pretty close to hitting the number of billion too. So it's a very small number and it's a very big number. It depends on facts are the same. Where you stand decides how you see them. How you see them makes all the difference. My submission will be that let's look at all the numbers, good things we have seen, global, transformation, sustainable, and ecosystem. Ecosystem is very, very important. And then create the foundation. Our foundation is of bamboo scaffoldings. But we want a 10-story building. Is it possible? No. So that can only happen when not just the 10% people, but 100% people educated. And that's when the governance will come in. Governance comes when everybody knows what they seek from the government. Today, 90% people don't know what to seek from the government. So that's what the challenge is. How do I see governance? I see governance when my expectation from government doesn't require too much effort to be met. So we create the index. Having said that, I think my time is up. I timed it to 10 minutes. And I'm sorry for this little bit of heat that I have and a bit of jet lag, but my privilege to be here. And thank you, Mr. Tucker. Thank you, Shriram. But my submission will be very simple. Let's make it simple. Let's look at the foundation. Let's look at the last segment of the people. Let's appreciate the fact that we are the same people. When we go in a system, we become more productive. Question is, if you can create the same ecosystem, we can be better productive. We have the potential to be as good as we want to be. There's no question about that. We are as good as we want to be. Let's help all of us to become as good as we can be. And with that, I'd like to thank you very much. Thank you, indeed.
Thank you, Satish Ji, for your insights into how global best practices in GovTech can be templated and adopted to Andhra Pradesh, how the institutional and policy framework is required to scale GovTech solutions in state of Andhra Pradesh. Now it is my pleasure to invite, there is a change in the program. We have moved the health tech session to in the place of GovTech. So it is my pleasure to invite Honorable Health Minister Sri Satyakumar Yadav Ji, Government of Andhra Pradesh, and also Sri M.T. Krishna Babu, Special Chief Secretary to Government of Health, Medical and Family Welfare. Sir, request you to join the dais. I request Krishna Babu Garu to deliver his. Sorry, I request Honorable Minister to speak, and then Krishna Babu Garu will deliver his keynote address. Subsequent to that, we will invite the panel for the panel discussion.
Respected Chief Minister of Andhra Pradesh, Gauraniyalu Chandrababu Naidu Garu, the directors of Global Forum for Sustainable Transformation, distinguished guests, officials of Andhra Pradesh, and participants andariki namaskaram. I am indeed extremely delighted to be part of this important conclave that throws some valuable light on possibilities of taking Andhra Pradesh healthcare to new heights. I sincerely compliment the team of Global Forum for Sustainable Transformation for taking this initiative, and also confident that the deliberations and outcomes of this important deep tech conclave will provide a roadmap and way forward for taking the healthcare delivery of Andhra Pradesh to new horizons. As we have already seen a few innovations in the exhibitions and also in the presentations, which can bring in a transformative change in the lives of the people, and more particularly in the health sector. I must thank the organizers for keeping this podium very low, so that I am not only audible and also visible. It is universally acknowledged that health is wealth. For the health of the people has direct impact on the economic growth of any individual, family, or the state, or the country as a whole. The historical analysis of 13 developed countries has established that 1% increase in lifetime expectancy has resulted in 6% addition to the GDP and 5% addition to the per capita GDP. Which highlights the healthcare of the people, impact of the health of the people and the economic growth of any country. In this background, now we are aiming to become, when we celebrate centenary celebrations of our independence in 2047, we are aiming to become Vikasit Bharat under the leadership of Honorable Prime Minister, whose extraordinary leadership qualities, out-of-box ideas, have transformed the otherwise bankrupt economy of the country into one of the top economies of the world today. And on the other side, we have a leader, a visionary leader, who in the early 90s itself envisioned, understood the importance of IT and the kind of positive change that can bring into the lives of the millions of youth, as also aiming to make Andhra Pradesh, Swarna Andhra Pradesh by 2047. The vision of the state and the country is defined by the two great leaders who have courage to dream, commitment for delivery, and compassion for the poor. Under their leadership, I am pretty confident that India will become a Vikasit Bharat by being one of top two economies, largest economies of the world, and also Andhra Pradesh, a Swarna Andhra Pradesh. But when I say so, the health to attain this, to achieve this by 2047, health assumes significance, because accessible, affordable health care will create healthy people. Healthy people in turn will add to the economic growth or wealth creation. So, in this context, we have many challenges in Andhra Pradesh, like even in the country, as we are still a developing nation, where many gaps, demographical, many diverse challenges. During these challenges, it is important to leverage technology to find solution to face these challenges and bring in a transformative change in the health sector. I'm pretty confident because the achievements of the health ministry and what the state and health ministry more particularly is affecting from this conclave will be presented by our Special Chief Secretary Krishna Babu Garu. But I want to say one thing. We have a huge data captured by our healthcare professionals, right from the ANM, ASHA workers to ANMs to CHOs to healthcare professionals in the teaching hospitals, collected from 10,000 plus wellness centers at the village level and 1,700 plus primary health centers at rural and urban areas, and more than 250, close to 250 community health centers, area hospitals, district hospitals, and teaching hospitals. But how do we integrate this data with the technology and bring in a betterment in the lives of the people and healthcare sector in particular? That's where deep tech solutions come into the picture. These solutions must provide predictive analytics, because my Honorable CM keeps talking about all the time about the new technologies, blockchain, data analytics, artificial intelligence solutions. These solutions should bring predictive analytics and therefore allowing us to take precautionary preventive measures and save the lives, and more particularly reduce the out-of-pocket expenditure of a common man or a patient, and also burden on the state exchequer or the nation's exchequer. So I urge upon the youth of the Andhra Pradesh, because Andhra Pradesh is known for intellect. There are lakhs of people, because of Chandrababu Naidu Garu, have migrated to America, and they are proving their mettle. So I urge upon all of them to focus more on this deep tech solutions and help the Andhra Pradesh health sector. And I know, you all know, the leader like Chandrababu Naidu Garu being at the helm of affairs, the investors or innovators will get every possible support in the state. I take this opportunity to urge upon, appeal Honorable CM, sir, form a committee particularly on that, and you have been bringing many policies in every sector. And also appeal you, sir, to bring in a policy for deep tech innovations in Andhra Pradesh, so that more and more youth comes forward and they will be instrumental in building the Andhra Pradesh, Swarna Andhra Pradesh by 2047. So I take this opportunity to thank the organizers for giving me this opportunity of meeting of all, and more particularly to learn many things. I am not a doctor, I am a health minister. I have been a health minister for the past 6 months. I have always been a political student or an engineering student. I never knew anything about the medicine. Nothing, and not even a terminology. But still, Honorable Prime Minister, Honorable Chief Minister of Andhra Pradesh have given me this opportunity to know many things and be an instrument in bringing a change in the lives of the people of Andhra Pradesh. Thank you all.
Thank you, Honorable Minister. Now I have the pleasure of inviting Shri Krishna Babu Garu to deliver his keynote address.
Yeah, a presentation. Good afternoon, Honorable Chief Minister of Andhra Pradesh, Nara Chandrababu Naidu Garu, GFST Thakkar Saab, Honorable Ministers, MLAs, MLCs, and all the other distinguished guests. So, I just wanted to just present about what this Andhra Pradesh Public Health 2, why we are talking about 2 is the way in which Honorable Chief Minister wants us to think, act, using the digital technology, using artificial intelligence, machine learning, and deep tech to take preventive action rather than concentrating on curative thing. Curative is always important, but coming back to preventive gives much better result. Our Swarnandhra tagline is towards wealthy, healthy, happy Andhra Pradesh. So by 2047, that is the kind of society Honorable Chief Minister wants to do. So this is, we are going towards that. Just I will present what exactly, where we stand today, what are the challenges being faced, and what we wanted to, all the invitees, GFST, I thank especially Thakkar Saab and the entire team to make available this much talent pool available to health department to think, to interact, and also to collaborate, developing a system wherein we can make this goal, happy and healthy Andhra Pradesh, a reality. So demographically, Honorable Chief Minister always talks about demographic management. That slide is gone. Just can you go back? So the main challenge is fertility rate is presently 1.54 and it is going to drop to 1.37 by 2047. So this has a serious implication about the dependency ratio may be the same, but the child, that is 0 to 14 years population, there will be almost 7% decrease, and 60 plus years population is around almost means from 14% to 23%, 9% increase. So this will be posing a real challenge in the economic development because the working age population is going to reduce. This has its own implications. That is why how to ensure that the fertility rate increases and also the dependency ratio comes down by creating a workable solution to the 60 plus age group population. We have overall, if you see Andhra Pradesh, we are having better indicators about access of the people to the health facility. Whether it is the village health centers, public PHCs, primary health centers, or area hospitals, beds for 1,000 population, except the CHC, coverage of community health centers, we are above the national norms, IPHS norms, and human resources also, Andhra Pradesh is fortunate to have very positive human resources. As per the WHO norms, whatever is required, we are much above that. Whether it is the doctors, including specialists, is 1.5 per 1,000 population, nurses around 3.8 per 1,000 population compared to 3, and 50 overall total population for physicians, nurses and midwives for 10,000 population, almost 50.9 compared to WHO standards of 44.5. This is a very positive way where we have good human talent pool, especially in the health sector. We just jotted down the Swarnandhra goals and SDG goals. SDG goals we have to achieve by 2030. Honorable Chief Minister always directs us to plan such that we reach the goals much before it. We are doing reasonably well, almost 4 indicators out of 8. We are already close to achieving the SDG goals, and balance 4. It is under 5 wasted, then adolescent girls, anemia, tuberculosis incident rate, and also life expectancy. These are slightly difficult to achieve as on today, but next we have 5 years time. Definitely we'll try our best to see that they are achieved. But Swarnandhra goal aligned with Viksit Bharat is a very tough call. So all have to change the way we plan everything and then ensure that we reach there much early. The percentage of out-of-pocket expenditure, now it is as per NFHS 5 survey, it is almost 63.6%. The toughest goal is this, bringing it to less than 5% by ensuring that health insurance for all is made effectively implemented. See, similarly, we have almost 80% of the population covers under NTR Vaidya Seva. So we have to make it 100%, and also we have to streamline. The government has already made a promise in the manifesto, the health insurance for all. Geriatric care facilities, presently we have in district hospitals, subdivisional hospitals and CHCs. Now the goal is to ensure that all the healthcare facilities up to the village health clinics have the geriatric facilities. NABH, NAQS, basically quality indicators. As of now, 7% of the institutions are given certification. So our target is at least next 2 years, we should at least reach 80%. We are working on that. Key initiatives, what we are doing is, we have to make a health profile of the entire population. So ABHA ID is one of the key indicator where if now as on today around 4.19 crore individuals we are able to do the ABHA ID, and which reflects to 80% of the population. Then when we do the survey, now NCD 3 survey is going on, we are doing universal health survey, wherein all the NCDs are being recorded, including the cancer care. So cancer, the preliminary screening for breast, cervical and oral cancer. Then all these suspected cases found out by the health level worker, village level health workers, CHO, ANM and ASHA workers, they will be confirmed by the medical officer. After confirming, they will be put on the treatment. Then continuity of care is ensured by almost line listing of the data is available to ensure that all are covered. Almost now the continuum of care is around 80%. Just we have to make it almost 100%. And also ABHA ID creation, now it is around 80%. We have to ensure that that goes to 100% in this screening. Then maternal child health care is another very important area. Almost 69 lakh children, especially 6 months to 6 years, and also school going children, we are having the health screening going on now. Then whoever is registered in RCH portal, pregnant women, they are tracking of them, seeing high-risk pregnancies and tracking and seeing that they get proper care such that the maternal mortality, infant mortality is reduced to substantially minimum. So we are doing anemia monitoring almost monthly basis for the pregnant women and quarterly basis for adolescent girls. And also follow-up is being done both at PHC and CHC level, and also referral services by iron sucrose injections and blood transfusion, and if that is not responding, then other referral mechanism. We have a strong EHR, now we are doing almost all the hospitals from PHC to tertiary hospitals. We are putting integrated electronic health records. So this is a centralized repository of the patient information, and this will be having continuity of tracking of the individual from primary health, from the preventive care aspect, from the primary health side till tertiary care. And we have integrated the primary health to tertiary care such that the people who are identified with certain problem, whether that referral is happening properly or not. So almost now we can proudly say we are the almost leaders in India to have almost 5.5 crore health records which are linked with EHR, electronic health record. And 19,700 health facilities are in the EHR. We have created ABHAs. Then health around 58,900 professionals are also done. Then unified data platform. So all the departments, ultimately the result will be when all the departmental database talks to each other, and we plan according to that and see whether the outcomes are coming or not. So we have developed a system wherein health, women and child welfare, school education, Panchayati Raj, municipal administration, all the databases are integrated with taking this API, and nutrition and anemia status of pregnant and adolescent girls, as well as health monitoring, high-risk pregnancy of the women, and also other side sanitation, vector control measures, water quality testing, all these are integrated such that the information with one department is available for all other departments to see and act. So, and also monitoring can be done at the senior level. Another thing what we are doing is existing whatever items are there, for monitoring of that we are using technology biomedical equipment, almost 1.33 lakh equipments are there, which are put on the system, and we know the exact status of how many are working, how many complaints are raised, how many are getting resolved, etc. Teleradiology services, similarly CKD and dialysis patient treatment, telemedicine consultation. Almost Andhra Pradesh is having almost 21% of India's total teleconsultations as of now. Almost average calls is 65,000 per day. So this is how we are able to make available the specialist services from the hub, from the specialist to the lowermost health system, that is village health clinics. Then with facial recognition, almost we have started using 106,000 employees of health department. Each employee, they have to register in the face recognition system, and they have to make attendance 3 times, morning 9 o'clock, 2 o'clock and 4 o'clock. So by that, at least compared to earlier time where only 60 to 65% attendance used to be there, almost when we started deducting the leaves, etc., based on FRS attendance, now almost it is more than 92-93%, and sometimes it is reaching 98% if including leaves, etc. Sanitation, security, pest control also, Honorable Chief Minister directed that the artificial intelligence, machine learning should be used to real-time monitor what is happening, what is the quality, rather than just depending on the report or feedback from the superintendent. So that is what is being done. What are the key challenges? Now, most of the data is in silos. So naturally, main integration, data fragmentation, so integration has to be there. So that we are trying. This is where we wanted to understand what best can be done in the shortest possible time to have visibility. Similarly, lack of outcome focused dashboards. So we have data for each of the items, but only thing is overall when we just review, we are lacking the kind of dashboards which will give real-time database. Similarly, data governance and also limited capacity of the employees to use the data and also build up concrete quality data. So then what is that we just wanted to have? That is, we want to develop a digital twin. Each of the person should have a digital image of him with the government, such that at least each person from the starting birth to death, he can be tracked and analysis can be done. So that is with advanced diagnostics. Then, of course, data privacy, as many of the speakers have told, that is the biggest challenge. So because this data should be available for understanding the geographical prevalence and also disease pattern, and identifying the root causes for the diseases such that we can take preventive action. So this is how the entire NCD survey data need to be used. Then we also want to introduce AI-assisted chronic disease prediction and taking preventive action to ensure that these kind of things at least will get controlled in the future. Similarly, genetic testing, as we know, even though it is expensive as on today, Honorable Chief Minister talks about genetic testing as a tool, because once the scale comes, the value, the treatment cost also will come down. So then at least personalized medicine protocols can be developed such that each person can be targeted for improving the health. Similarly, tech-enabled preventive care management, and also to create total data lake from entire databases available in the health sector and also the related departments, to ensure that we have actionable dashboards with proper information, such that we can do much better in this area. So what we can offer to the people who wants to work with us? We have huge data. At least the masked data can be given, wherein our Thakkar Saab has told sandbox. So the masked data can be given for analysis, because this much data, I don't think the people will not get, any startup company will not get in the entire country. So that data we can provide such that you can use it, you can build models, and also you can do, use case scenarios or pilots you can do, proof of concepts you can do, such that at least it will be a win-win exercise for both the developer as well as the government. So this can be done through virtual PMU. We are having now virtual PMU. We have tied up with our MOU partner with Swasti Group, and also we are trying to onboard many people from of Andhra origin who are doing excellent work in IT, in healthcare sector, elsewhere, such that virtual PMU can be made, and also they can screen the projects proposals which are coming, which will be reliant to Andhra Pradesh. Similarly, data and AI center in the policy and practices also we need help for the people who are having expertise in this. And also we also want to put MedTech center of excellence, because many diagnostic equipments are coming, many systems are getting developed. We also want it to be screened by professionals such that the right kind of thing which will be useful to the AP can be used. So this is what we can offer. So any company, startup, or the use case scenarios, you are welcome to just come to us, collaborate with us. We are ready to offer whatever assistance is required for doing quality pilots. Thank you very much.
For the logistic issues, we are moving this podium to the ground because now we have more speakers. We don't want any blind spots on the dais. Now what we are going to do is, we have an extensive health tech panel. Already, since we are overshot the time, I will be inviting the moderator. So she will invite the rest of the panelists, and then I request the moderator and the panelists to stick to time, because Honorable CM Sir expressed his intention to have an interactive session immediately after the health tech. He wants to interact with all the...
I'm going to tiptoe. Thank you for the privilege of being here. A very warm welcome. I'm going to be a bit loud because it's a post-lunch session and I can see some people snoozing. Feel free to stand up and stretch yourself if you like. I think that's good for you and good for the blood circulation. But before I start, maybe we could start with a resounding round of applause just to wake us all up and energy. Because why? Because health is wealth. Is health wealth? Yes? So can I get a louder applause? All right, I do see half the room waking up. So that's great. Health, Satyakumar Yadav. My name is Dr. Anjali Chaudhary, and I'm the Chief Catalyst of Swasti. It's an Indian-born global public health organization that tirelessly works for vulnerable communities to bring 100 million healthy days by 2030. And since I have the stage, I'm going to take 2 seconds extra to say, sir, when I was a dental intern, I was part of your Janmabhoomi program from a large group of dental colleges in Bangalore that were very excited to come to their neighboring state and support districts like Andhra Pradesh, Chittoor, Tirumala, and Tirupati. And I must say I was the only non-Telugu speaking person, but at the end of 2 weeks I did learn dental language in Telugu, so just an aside. But I want to say that AI and deep tech, like Krishna Babu Garu just mentioned, focuses on population health management and disease prevention. From the morning we've been talking about diagnostics and R&D, which are very important, very less talked about in the public health and surveillance scenario, like population health pattern analysis. If we didn't know where the population was going, tomorrow we might end up with non-economically productive populations. So we have to have those analytics. Environmental health monitoring. Do we know when is the next extreme weather event? Human resource allocation. We all saw what happened during the COVID response. We didn't know how to quickly multitask and quickly deploy good human health workforce to space. And health equity analysis, most important and dear to me. Who are the people left out of the health systems? Who's not getting the services that they need to get? And of course, contact tracing and health communications. These kinds of technologies using AI and deep tech help us make good governing, good health decisions that implement preventive measures across the community, leaving no one behind. They are particularly valuable to prevent pandemics, to address health disparities, and improve population-wide outcome. The key risks, so I have the pleasure of inviting a very good panel, but let me not postpone that. Very quickly before we get on to that, Andhra Pradesh is special. We have coastal vulnerabilities here. This is a key subject. While I work, in my organization, working with farmers, fishers, women and garment workers, etc., they are faced by a barrage of environmental risks, and they are only increasing in frequency and in extremities. Andhra Pradesh is not, it's special that way. You have a large coastal region. Coastal erosions are affecting fishing communities. The saltwater intrusion into agricultural land, people depend on them for livelihoods, and we depend on that for food. We have heat waves, we have dry spell, we have droughts, and there's massive agricultural impacts and weather security issues. So before I start the panel, we have a short presentation on what climate resilience and deep tech and AI applications into climate resilience. May I invite Dr. Dinesh Arora from ADB to present the financing on climate and health. Thank you.
Thank you, Angela, and thank you, Honorable Chief Minister, and thank you for a wonderful presentation, the principals, the Additional Chief Secretary from Andhra Pradesh. I just wanted to sensitize on an issue which is rarely discussed. Pakistan suffered floods in 2022. 15% of its primary health centers got destroyed. About 4 times snake bites increased because of the flooding in that area, but the public health centers were not ready for this. Why did they collapse? Because they were not resilient enough. Bangladesh is having dengue across the year. It used to be only seasonal, 2 months. But now because of the rainfall patterns, increase in climate change and heat, the mosquito breeding has increased. New viruses are coming. If our glaciers melt, 50% new organisms from the permafrost will come, and we are not sure how we deal with them. This is one, Honorable Chief Minister, I wanted to sensitize on one issue of climate and health which is coming up. And many naysayers in the past have become yes-sayers for this. And Andhra Pradesh is no exception to that. We have floods, we have perceived temperatures, like in Visakhapatnam, because of humidity, it could go beyond 50. Informal workers, mainly ladies who work in the farms, how do we help them mitigate this loss? Animal health, the bird flu is so common, Nipah viruses. In fact, 5 of the 6 pandemics have come from animal origin. When we talk about health, animal health should be part of it. Unfortunately, we always talk about human health, leaving out animal health, which has been responsible for most of the crises, including COVID-19. 5 principles G20 India adopted this year, last year when they were there. And I just wanted to take you through those 5 principles. The first principle is resilient healthcare. Can our health structure stand when earthquake, floods, or any damage happens, or cyclone happens? That's called resistant. And if any damage happens, they become responsive and come back normally. That's resilient infrastructure. We do it for many things, but do it for health services, not only for infrastructure, but even for our health workforce has to be climate resilient. So I will showcase 2 tools One is patch, which is being used in Philippines, and I'm glad that today Andhra Pradesh is signing MOU for that tool to use. How do you maximize resources when such cyclones can be predicted? And second, on urban health tool, heat tool. Can we predict heat waves and how do we mitigate with them? The second principle is building low carbon health systems to decrease carbon temperatures. Electrification through renewable energy, electrification of ambulances, use of LED light bulbs are very simple ways. Similarly, decarbonized health centers. Can Andhra Pradesh lead India in doing a decarbonization mapping of its health services like NHS has done? Sir, NHS is targeting NHS hospitals net zero by 2040. Can Andhra take that lead? And we are here to support and work with you on that. Green supply chain, whether it is vaccines, therapeutics, diagnostics, the packaging, can the material be used so that it has less carboniferous? Climate financing. In fact, sir, why I am talking here, because in the name of climate for health, we will get a lot of grant financing. So even if the loans come from World Bank or ADB, they can, interest rates can buy down with this, and it can be actually at zero interest rates. One very interesting is health insurance. Sir, you are the pioneer of the scheme which has been across India now. I was the deputy CEO of Ayushman Bharat, the PMJY scheme. Sir, we have today 5-star ratings of AC air conditions, that how much energy they save. Can we have 5-star rating for, if I am using a knee replacement, how much carbon it has taken? Can we move towards incentivizing low carboniferous productions? It is possible. US and Korea are contemplating, can Andhra take the lead and come up with a incentivization mechanism for knee replacement, hip replacement to be less carboniferous? And of course, let's have animal health, not forget animal health should be part of human health when we discuss health pandemic preparedness. Sir, this is the patch tool. Sir, I'm glad today you are signing MOU with them. With this, we map climate data with health data and actually can predict that what cyclones are coming. And this was done in a study in Philippines, in one of the counties, and we could predict that when damage is coming, are the kits ready? Are the health workers trained enough? Is there a backup for the vaccines, for the medicines to be stored? Simple thing, when floods happen, do we have 3-store building where we can store ORS so that rehydration can be given when the floods are hit? This has been very successful in Philippines, and I'm glad Andhra is taking that lead today. Similarly, this is a tool of using AI with mapping from climate data to come up with heat maps. 60 meter square heat maps can be generated, and then we can predict in these hours there should be limited activity on those days. We're also coming with the parametric insurance. If there are 3 regular days of heat, women who work in the field will be compensated through an insurance scheme, which is being done through SEWA right now by Swiss Re in a pilot way, but it is being taken globally. Couple of these things where we like to highlight and come and work with your team here to get them a parametric insurance for heat stresses. This is the 60 hexagonal, sir. So the climate is not only temperature, it's humidity. It's also the base structure of anthropogenic surface area, greenery, water bodies, which can be mapped, and then we can predict what are the urban islands which we need to protect against heat stresses. Finally, one of the best practices I wanted to highlight is Center for Disease Control. Normally it has been done only for vector-borne diseases, but today concept is changing. It's for non-communicable diseases, it's for communicable, and it's also for animal health. The ASEAN CDC, which ADB is supporting, is now the latest one where we talk about one health workforce, which is human health, veterinary doctors, and the paramedics all coming together, which not only bring the solutions, but also to the economic researches. So I think we can have one CDC established in Andhra Pradesh, which can actually lead the way and could then become a regional CDC for many other states and in fact for the other countries also. I think I'll pause here for the time. Thank you. One last slide, sir. Climate vulnerable diseases like dengue, chikungunya, TB, these are becoming. So there is a huge catalytic grant capital available from Gates, Temasek, Tahir, Tata Trust. I think Madhav is here. Green Climate Fund. We can channelize that grant financing so that we can have meaningful impact on how do we decrease climate vulnerable diseases, come up with the newer vaccines for dengue. Why should it take 60 years to come for a vaccine for TB when it took 9 months for COVID? Because it's in the third world. But can we use this grant financing along with the multilateral financing from ADB World Bank to channelize resources and end TB, malaria in Andhra Pradesh, in India? One last snippet, sir. The specificity of tuberculin test is only 50%. World over, we have moved towards TruGen, X-Gene Expert, AI-based X-rays, but still 50% in India are still being used for specificity, which has only 50%, the clinic diagnostics. Can we move to neo-diagnosis for TB, which can eliminate that? That's my last appeal, sir. And the telemedicine is not only increasing access, as I think the Principal Secretary showed a wonderful presentation, they're talking about smart health ATMs. In fact, it is also less carboniferous, and it decreases huge less when traveling expenditure is not there, people are not going, they get medicines at one pair. Telemedicine, in fact, should be the aim we move forward. And when the Principal Secretary did mention about the futuristic IT tech, sir, I have just one request. Imagine at 2 a.m. in the night, a pregnant mother is having palpitations. What should she do? Can we have a system which sir mentioned? She calls up a call center, they recognize the mobile, they have a Abha ID, they say, hey, what is your happening? Suddenly the triage goes to a nurse. She explains, okay, can you have your BP? Can you take your lime water? Are you able to do? They send an ambulance at home at 2 a.m. in the night. The concerned nearest hospital is informed that a pregnant mother with palpitations is coming. She goes there. If everything is fine, she returns back. There's a continuum of care. Next day morning, a specialist is arranged where at 11 o'clock her appointment is fixed. She goes there, gets medicines and comes back. That is perhaps Swaran Andhra in patient-centric terms, which I think the team is trying, and we are here to support that. Thank you.
Thank you, Dr. Dinesh, for highlighting the connections between climate and health, and more so highlighting the interest-free financing that's available for climate and health initiatives. May I now call upon my panelists. We are very fortunate to have some of the brightest minds that I have worked with in this space, and so we'll all have the privilege of hearing them as well. In quick succession, Mr. Madhav Joshi, CEO of the India Health Fund, Dr. Pranati Reddy, Clinical Director, Rainbow Hospitals, Dr. Sanjay Sarin, CEO, IKP Knowledge Park, Dr. Rora is already here, Mr. Amit Nagraj, Senior Health Specialist from the World Bank, Dr. Sanjay Patan Shetty, Director, School of Public Health, NIMS University, yes, and Dr. Srinivas Madhuri, Department Head, University of Basel. Would you please take the stage? Thank you. Srinivas Khosla, Dr. Srinivas Khosla. I will start. Okay, thank you for being here. This panel is essentially about how can AI and deep tech help us all achieve the goals of Swarna Andhra Vision 2047. And because this is a very large panel, I'm going to stand so I can see all your faces. I'm going to start with you, Dr. Srinivas. The first one, Dr. Srinivas. We have two, okay, for all of you, we have two Dr. Srinivases and two Dr. Sanjays. So this is going to be a fun panel. The first Dr. Srinivas in the green. My question to you is, how do you, please introduce yourself in short, and how do you think AI and deep tech can help Andhra Pradesh reach its
Thank
goal?
you very much for giving this opportunity. Respected CM, Mr. Chandrababu Naidu Garu and other dignitaries. Yeah, AI is definitely the major tool that's going to play a role in healthcare. But the main thing, we need to use the AI, especially in a program called REACH. It should be very effective in the rural, effective, comprehensive healthcare. Now, this has to play a role based on the sustainable healthcare, a consistable healthcare, a deliverable healthcare, and most important, in a transparency way. Now, how it works exactly is, it should create a blended financing model where the patient needs to be looked upon as a deliverability for care in a possible way where there is no finances involved. For that, we always recommend a model called no cost, low cost, high cost. It's at different levels of organizational aspect based upon the schemes that are available from the government, which should be very much delivered. Now, for that, we need to be able to identify an issue. It could be a micro issue or a macro issue. Now, taking a micro issue, it could be a single focused agenda of a disorder. For an example, coming from Hyderabad, the GSR hospital, we deal with a specialized aspect called the Center of Excellency for Craniofacial Anomalies. For the last 30 years, we have delivered care for the state of Andhra Pradesh for more than 40,000 patients. We started this way back in 2001, where we used the Janmabhoomi project, and at that time we had a wonderful secretary, Mr. Parida, where he could identify in the census the incidence of these facial deformities where the children are born without nose, without eyes, without ears, without lips, or some sort of deformity. Then we had an incidence. Now, this was in 2001. But now, if we exploited that same incidence, we have it more than in 5 folds. Now, what exactly we can do is, using this incidence, now going back to reaching to the care at the primary level. Now, using the AI, we already come up to what you call as a predictional outcomes. We have subclassified all these disorders. We know what is the treatment methods that we have to use. And next thing is, by using this model, we can identify the outcome measurement. So the basic problem of the patient is the feel of shame and the fear of scare to go to a hospital. So if you could explain to them, so they go onto the app, which is available with the Anganwadi worker, which go to the house to house, where they see a child with a defect, where they just scan it, and then they get the picture and they put it into the app, and then it automatically tells you what sort of the defect it is about. Now this defect, how the treatment is done, what is the length of procedure of treatment done, where all it can done, and then the outcome out. So that gives a confidence to the patient to go forward. This is how the AI can be used at different levels in the healthcare system.
Thank you, Dr. Srinivas. So you talk about last mile reach, last mile app, and a low cost, high cost blended financing model.
It's called the blended convergence model.
If you could please pass the mic on to the next Dr. Srinivas. Dr. Srinivas, given all your high and deep work in Andhra Pradesh and the fact that you're from the academia, could you highlight how AI and deep tech can actually be leveraged, particularly in your line of work and what you'd like to do here?
Right. Thank you, Angela, for having me here. Honorable Chief Minister, Thakkar sir, thank you very much for having me here. I came from Basel University. I am professor for regenerative medicine. I'm here today to share with you some of my experiences, and I would like to propose to the Andhra Pradesh Honorable Chief Minister sir about an excellency center, a high-tech campus for biotech and medtech. One can actually create a combined campus for biotech and medtech. Biotech has around $500 billion market. Similarly, medtech also has huge market, close to $500 billion, and this can grow at a 17 to 20% increase annually. That means that gives you a huge opportunity for bigger growth for Andhra Pradesh. Consequently, we can also position India at the global scale. And I would strongly advise to take this opportunity and create such ecosystem. And creating an ecosystem is extremely important, first of all, to actually attract the key players in the field. And to be able to become one of the key players, we need to have the substance in place and ecosystem in place. And the way to do that is to bring the best brains working across the globe and have the global connectivity.
Thank you, Dr. Srinivas. Sorry to cut you short. We just have 15 minutes. So, sure. But I think we heard the core of your content is on really multi-stakeholder partnerships, with academia playing a very strong role. Am I correct? Mr. Madhav, over to you. A line on what India Health Fund does and where AI and deep tech plays a role and how it gets support. Not a line, but yes.
So India Health Fund is a catalytic fund set up by Tata Trusts based on two significant hypotheses. One, that innovation for public health had not received the kind of funding that it needed for development, largely because public health was either funded by governments or represented underprivileged patients. So there wasn't enough return for the private sector to make the investments needed. So Tata Trust stepped up, and this was Mr. Tata's personal passion project, to create a fund that would create technology for healthcare from India for the world. Deep science and deep tech play a significant role in what we do. About 70% of our investments have either been in AI-based technologies or in molecular diagnostics and emerging areas. And very relevant not just for development, but we've been partnering with organizations in the state of Andhra to validate some of these technologies and for pilot scale deployments. So.
And what opportunity do you see? So Krishna Babu Garu had mentioned that there is going to be a medtech center, a virtual PMU. Do you see any opportunity there in terms of collaboration?
I do. The biggest issue in development of AI-based solutions is data. Good data drives good solutions, and access to data is a challenge. The state has the best access to data, and the Chief Secretary, or the Health Secretary has already made an offer to provide mass data.
Yes.
Now, what this can do is ensure that the diversity of patients in the state is used to develop AI-based solutions, which are then more accurate and more accessible to not just patients in the state, but the state doesn't have to depend on AI developed in other parts of the country or other parts of the world, which may or may not have the same level of. So I think there is a significant synergy, and one should really build on this.
Thank you. Dr. Arora, I'll come to you now. You are making notes on the theory of change. So maybe you would like to highlight what some opportunities are from where you come from in where Andhra Pradesh is seeing its 2047 vision.
I think, thank you, and I think it's a dream occasion to be where Honorable CM is listening to you, the Honorable Minister, Honorable Principal Secretary, Mr. Thakkar. I think, sir, make AI as a digital public good. In the morning, I think the CM mentioned about Aadhaar, a stack on which we actually built many things. Can AP lead this? When you talk about sandbox, can we incentivize private sector to come, show innovations and take them to scale? For a public health specialist, AI should be for public health. I have no issues with personalized IoTs like smartwatches. I am using one, but then it's not for masses to be used immediately. What is required is how do you do surveillance, diagnosis, outbreak and solutions, including NCDs, on a massive scale and do preventive diagnosis. So for me, the opportunity is how do you make this AI mainstreamed within the health, use it as a digital public health good to deliver early screening and prevent diseases. That is perhaps the one of the most important, and AI will help in research, in conducting clinical trials and giving us solutions. And then government should help them, taking them to scale. Scale comes only with the government's approach. Irrespective of any philanthropy, any multilateral bank, if government adopts it, it goes to a scale. And this is where government can create that differences of impactful intervention. Thank you.
Thank you, Dr. Arora. Sanjay, I know you from your earlier avatars, and now very nice to know that you've moved to Hyderabad. Question for you, in the space of diagnostics and market shaping of diagnostics, you've been hearing all the startups earlier today, and there was a wonderful stall out there, and you heard the vision of our Honorable CM as well as Health Minister. What does that opportunity look like for an institution like the IKP?
Yeah, first of all, thanks for the opportunity, and thanks to the Honorable CM. I come from IKP, which was set up back in 1999, thanks to the public-private partnership mode, where 200 acres of land was donated by the Honorable CM, who was the Chief Minister of the undivided Andhra Pradesh. So one of the silver pandemic was the unprecedented focus on true point-of-care diagnostics. And when I say, true point of care, I want to make a distinction between the regular point of care and the true point of care. It means that diagnostics which can be as close as possible to the patient. And when we talk about true point of care, there are really two trends that are emerging. One is instrument-based point of care, and the other is instrument-free point of care. And there are, a bunch of technologies which are now already becoming available. So there is one, for example, Plus Life, which is a multiplex true point of care, which means that you can conduct or diagnose multiple diseases at the same time on a PCR platform. And they are looking at a disposable PCR platform. And there is a collaboration right now going on between this company and Huvel Biosciences, which is a company in Hyderabad. There's another one called COSARA Diagnostics, which is home-based PCR. They have simplified the PCR to an extent where it can be used, within a domestic setting. And they're also getting into a joint venture with a company called COSARA in Ahmedabad. The second key trend in diagnostics is, integrated diagnostics. When you're talking about taking diagnostics to the last mile, you cannot really afford a chemistry analyzer, a hematology, immunology, and molecular. So they are now building integrated platforms where you have chemistry, immunology, molecular diagnostics, all happening on one platform and very simple to use. There are very few companies which are right now in this process, but there are very good chemists and there are very good immunologists here in India and specifically in the state of Andhra Pradesh, and their skills can be leveraged to produce these technologies. There is one platform called Fluxurgy, which is in this space. The third trend is obviously looking at alternate sample types. There are newer samples like urine for tuberculosis and tongue swabs for tuberculosis, which are now becoming available. They're easier to collect and, obviously easier for the diagnostics, to be implemented at a field level. The fourth point which I wanted to mention, which you specifically asked about the market entry, is the biggest valley of death is that a technology becoming available and it not getting to the masses. So I think it is, I've been hearing since morning that there's going to be a lot of focus on last mile access. Yeah. I think it is extremely critical, for the states to be able to work with these developers in order to make sure that there are mechanisms that are put into place so that these technologies can reach the people who need them the most and at scale. And it is great to see that the state of Andhra Pradesh, under the leadership of Honorable CM, has announced Anantapur as a proof of concept. So these technologies can actually be, tested at a proof of concept level and then potentially be scaled up.
Thank you, Dr. Sarin. Dr. Praniti Reddy, we heard today about the state's priorities on cancers, particularly breast and cervical cancer. We also know women's health is at the front and center of the health department's goals. We heard from Krishna Babu Garu actually highlight that. As a world-renowned OBGYN and director of Rainbow Hospitals, how are you already using AIM Deep Tech and what opportunities do you see for the private sector?
So I am from the area of maternal health, and it was very interesting to see your presentation, sir. First of all, I would like to congratulate the state of Andhra Pradesh that you have already reached a maternal mortality goal which is far lesser than the SDG expected goal, and you've set for yourself a target which is very ambitious. You want to reach below 5, and I think to reach that below 5 will need a lot of hard work. It's a bit like weight loss. You can lose the first 10 kgs very easily. When you come to the next 10 kg, it's the stagnation. And I think as a specialty, maternal health care lends itself extremely well to technology. It lends itself extremely well to technology because it's a very structured journey that a pregnant woman follows. 95% of the pregnant women go through a very structured journey. The interventions are very structured. They're extremely predictable. Right now, what is happening is that the focus is entirely on what is going to happen during childbirth, how we can reduce maternal mortality during the process of birth itself. And that is, in terms of institutional deliveries and having midwifery-led care. But I think the focus now and what technology will lend itself to should go on to the antenatal care that we are providing for women, because it can be extremely structured and technology can come in very well at this point. And because if you pay attention to the antenatal journey of the woman, you're going to create a woman who's strong mentally, who's strong physically, and who will have less less risk of dying during childbirth. While childbirth is a critical period in the journey of pregnancy, it's a very small, the penultimate lap that somebody has to run to go through that process. So technology will play a big role in terms of not just telehealth. Right now we have women coming for about 15 to 16 visits during pregnancy, and that's redundant. It becomes a big roadblock. They should not really need to come to the hospital more than 3 times during pregnancy, and the rest can be taken over by telehealth. And by telehealth, I just don't mean teleconsultations. I think in the field of pregnancy and childbirth, education plays a big role, and I think technology should be leveraged to educate not just women. I think at this point, reducing maternal mortality should shift to families and communities also, the responsibility. So I think it should be a community goal to ensure that no pregnant woman suffers any complication. We also have a number of AI systems which we are using right now to risk stratify women at very early stages in pregnancy. So by the end of the 8th week, before even the 3rd month, we can risk stratify and say which woman can develop preeclampsia, which woman can develop heart disease, which woman can die because of bleeding. And I would envisage a time, sir, where no pregnant woman should ring at 3 a.m. and say she has palpitations. We should know at the onset of pregnancy which woman can have palpitations and prevent them before they occur. And building women antenatally, making them strong mentally and physically, is not just going to reduce death in childbirth. It should simply reduce the risk of death in childbirth. And that will happen by leveraging technology to spread education. And education is the single most important thing. And antenatal visits now have become about eating iron, calcium, and taking tetanus injections. And that should not be the focus of antenatal care. It should become a way of life. Pregnancy, that 9 months should be a way of life.
Thank you, Dr. Reddy. Thank you for eloquently expressing what's available right now in AI. Amit, I know you for many years now, maybe 15 years or so, and your deep work in AP and financing health sector reforms. So can you speak to this audience about what's the next movement for the bank, especially in this particular area of AI and deep tech?
Thanks, Angela. So let me first acknowledge, the kind of health outcomes the state has achieved in terms of your, maternal mortality, neonatal mortality, and so on, has been pretty good. And this is as a result of the outputs which we see in terms of the improved immunization and the institutional deliveries. And all this have been driven through the kind of investment the state has put in the human resource for health. AP is the only state in country which has less than 5% vacant position of specialist, which no other states could achieve. Your health infrastructure has been significant in terms of the access. 3, the kind of data or the digital interventions which we see is tremendous. And Krishna Babu sir has already, put the numbers very clearly. So these are like few very clear outcomes which one can see. However, the challenge is we have solved for the access, but the quality still continues to be the issue. And the majority of the deaths which are happening are largely because of poor quality of service. So that is something which one has to look at very carefully. The other challenges are also being related to, your communicable disease like TB. The numbers still continues to be the high. The number of C-sections and the teenage pregnancies and the adolescent health is also a larger problem. And until unless we try to resolve that, I don't think so we are going to really achieve what we want to achieve. Before I close, there are a couple of just 2 points which are very important. Again, the health insurance program in state is pretty old, but it's not the coverage which is important. It is the effective coverage which is very important. And when I say effective coverage, probably, even if you are able to look at, access to a comprehensive care package, which can ensure reduction in out-of-pocket expenditure. So let's, maintain up to 20%. That would still be a good deal in terms of looking at the overall thing. Second point is the epidemiological and demographic transition, which is beyond our control right now, have posed several challenges. Now, whether it is in terms of your aging population, your non-communicable diseases, is still not being controlled, and there are interventions which are outside health, as Dinesh rightly mentioned, need to be handled carefully.
Thank you. Thank you so much. Dr. Sanjay, I call you here for two reasons. One is that you lead the Axel Priest School of Public Health, and you also have a school on AI and robotics that I want everyone to hear about. So I want to know about the collaboration between the School of Public Health and the School of AI and Robotics. And second, I know that you have a special invitation for everyone here, so the floor is yours.
Thank you. I'll explain the philosophy behind why we have two schools. I think every university has a unique opportunity to create an ecosystem, because university is basically a universal knowledge hub. How do you ensure that there's a cooperation, there's a philosophy behind it? See, the training programs are sectoral, but the problems are intersectoral. We need to really think about our education system. Are we doing intersectoral programs, or are we still being a silo in sectoral programs? Policies are mostly sectoral, but the problems are intersectoral. Then again, policies are national, but the problems are international. So intersectorality in education and research is extremely important. This is the philosophy behind. At NIMS University, we have Institute of AI, Robotics and Cybernetics. In the same campus, we have a medical school and we have a public health. The message here is very clear. When you talk about AI, there's a triangle which influences the way you work on. One is security, the other one is privacy, and the third component is business. So how do you balance this triad becomes extremely important. So one message I have, to the Andhra Pradesh, which is doing extremely good. I'm extremely happy here listening to all the developments. My only request is, if we can invest on primordial prevention more, because by doing this, you are actually intervening before the emergence of risk factors. So we have to deal with unknown unknowns. Right now we are doing good in known knowns, known unknowns, but the future is unknown unknowns. So you need thinkers and implementers in this area.
Thank you so much. And what about the special invitation?
Yeah, this special request to the Honorable Chief Minister, sir. Sir, NIMS University has taken the lead to host the World Health Summit regional meeting in New Delhi. World Health Summit is happening in Berlin since 2009, but this is the first time in India. It will be hosted at Bharat Mandapam from April 25th to 27th. What I told Berlin team was a very bold statement. I said, you have a history, but we will create a history. Sir, please accept our invitation as guest of honor. I know from the we'll be very happy, sir, with the developments, with the case studies, because the regional initiatives which we start have a global impact, but nowhere, because as Indians, we are very nice people. We don't speak much, but we do a lot. Sir, please accept the invitations. Thank you, sir.
Thank you very much, Dr. Sanjay. Before we move on, I'd like to invite Ms. Vinutna, the Assistant Collector of Anantapur, who has actually started using the virtual PMU already to draw some conclusions of her own. So if you could quickly come up to the dais, because we've been told we're really running out of time. Thank you so much.
Good afternoon to Honorable CM, sir, Honorable State Ministers, respected Chief Secretary, sir, all the respected seniors and august audience present here. I am Vinutna IAS 2023 batch, Assistant Collector Anantapur. Sir, as an aspirant preparing for the civil services exam, healthcare is always an area of deep interest. Now, after 7 months of entering into the service, it has become real, and I realized the crucial role healthcare plays in governance. It is a matter of immense pride and with deep gratitude, I stand here today to share with you all the pilot data analysis project we are working on in Kuderu Mandal of our district Anantapuram, in collaboration with the Swasti team and under the guidance of our district collector, sir. As a part of the vision of our Honorable Chief Minister, sir, in line with the Vikasit Andhra Pradesh 2047 and also Vikasit Anantapuram 2047, out of several others, two of the major targets we have chosen include from 23 per 1 lakh live births of maternal mortality rate as per NFHS 5, we want to bring it down to 0 and reduce the anemia incidence percentage from 57 to less than 1% and intensity level in a targeted manner from severe to moderate to mild. Aligning with these thoughts of the district administration, Swasti team had come to Anantapuram, coupling with their concepts of precision action for the climate health and virtual PMU, we worked extensively on data and came up with a pilot Swarna Anantapuramu analytical dashboard. So as mentioned by our Honorable Health Minister, sir, re-emphasized by the Secretary Health, sir, we have humongous data being collected on a daily basis at our PHCs, sub-centers in India. Andhra Pradesh stands first in place in terms of electronic health records data. Swarna Anantapuram is one such data analytics dashboard platform that aims to put this data to right use for the larger public good. For doing this project, sir, we have chosen a PHC in Kuderu Mandal of the district, which is catering to 40,000 population and that is receiving 100 to 150 cases every day. So these are the objectives, sir, which we aim to achieve using this platform, Swarna Anantapuram. One is data triangulation. First, we have different sources of data. We want to bring it all to one place. Comprehensive and advanced analysis. We have realized that, sir, we need a life cycle approach. There are so many forward and backward linkages. Maternal mortality is not exclusively maternal mortality. There's also forward linkage to it and there's also backward linkage to it. So we have to do comprehensive and advanced data analysis, and this will aid us in evidence-based decision making. And also this dashboard aims in addressing the issues at the right levels and timely escalations whenever needed. So what is, next slide. What is the methodology we have adopted is the given below. One is, first we have reviewed all the data. We have various sources of information like seasonal diseases, TB, leprosy, malaria, dengue, non-communicable diseases. There's so much of data, we reviewed it all, and then data triangulation has happened, and then data engineered, cleansed it, filtered it, and processed so as to derive appropriate insights that will in turn help us in making the right decisions. All of this will ultimately help us in making tailored interventions and customized decision making. The dashboard is as follows. Next slide. So this is the Swarna Anantapuram dashboard, where what is shown here is the climatic patterns and the key trends of health indicators. So these are the pregnant women, number of ANC visits done, timely visits percentage done, number of anemic women, and also percentage anemia improved, and the last 2 years maternal deaths recorded. Next slide. This is an interesting correlation between, if you see in the graph below, there is a certain spike in particular months of the year where because vector-borne and water-borne illnesses in that months of the year are rising, and that heat map is the diseases vulnerability of the respective mandals in the district. So this is the spikes we observed in the months of the district. So now we analyze it that this data analysis and evidence based, we can take it a step forward by integrating it with AI-powered prediction analysis and understanding and foreseeing the future. Next. So these are the 3 steps, the 3 triangular steps. One is bringing it all together, then virtual PMU, bringing it all together, and AI and ML, risk prediction, then progression tracking, response prediction, predictive modeling, and also flow management. Adopting a life cycle approach, we can do this customized treatment plan. So we have also seen that for all the technology to kick in, we need to plug small loopholes which we have at our ground level staff. One is that they are the ultimately entering data, they are doing it, they are the field level functionaries. So the connectivity, logistics issues, and the capacity building they need, the training we have to impart to them, these are the things that needs to be emphasized, and also awareness and de-siloization between different departments. So sir, I would like to end with a quote of which says that humans had to struggle against exploitation. The real big struggle will be against irrelevance. To keep our PHCs, health and wellness centers ever relevant, data and deep technology should enter into them when the time is right. Thank you, sir.
Sir, Honorable Minister, I hope you're feeling very proud of the Anantapur team, because they actually did this in less than 72 hours. Less than 72 hours they put together this dashboard, and Ms. Vinutna only found out maybe 24 hours ago that she was to make this presentation. So we are very proud of Anantapur team, and you should be too. I'm told that we have to vacate the stage right now, so that's all the time we have. I'm really sorry. Thank you. Please give a loud round of applause to the panel here.
Thank you, Dr. Angela.
Thank you very much.
And I thank all the panelists. Sorry, if we have more time, a lot of insights would have come, but nevertheless, there is always next time. Thank you very much. Ladies and gentlemen, now we will move into the most exciting session, where Honorable Chief Minister would like to interact with participants, key stakeholders. I am sure it would be very, very interesting session, because I have conducted a couple of them in Hyderabad. So it would be my pleasure to invite him and Thakkar sir onto the dais. Then this session will be moderated by Shiv Kumar, Chief Executive Officer, founder of Swasti. I request him to come onto the dais. And we have 4 students moving around in the audience who have mics. So you can raise your hand and ask them to give you mic. But please be brief. This is not a speech session. Be quick if you want to have a suggestion or ask a question. Then Honorable Chief Minister would definitely would like to interact with you.
Good afternoon, ladies and gentlemen. Can you hear me in the back? Raise your hands if you can hear me in the back. Put both your hands up. Okay, now clap. I would like you to clap really loudly, because we're going to have the Honorable Chief Minister interacting with us shortly.
What is it?
As CM Garu comes onto the stage, I'm going to have a special request, because we had a panel which got cancelled earlier, and I'm going to call on those names first for the individuals to speak. Honorable Chief Minister Chandrababu Naidu Garu and Mr. Thakkar Garu, welcome back to the stage. This is a great opportunity to interact with the audience. Audience, I'm like people say, right? Don't stand in the way between lunch and us. But I'm going to stand in your way. I'm going to help you ask the questions so that CM Garu can respond, or if you have any advice to offer. There are 3 things we're looking from you. One is, do you have a question? Do you have advice for Andhra Pradesh? Do you have a suggestion to make? And I would request you to be very brilliant. What I mean by that is be brief. No more than 10 to 20 seconds. because we would like to, and I'm sure CM Garu would like to hear from all of you who have a point to make, right? There are going to be 4 people, students. Thank you, students, for helping us move around. Can you put your mic up so people can see you? There are 4 students who are helping us. Please give them a round of applause to the students. They will take your points. So the way we will do this is that, as I said, if you have a question, if you have an advice or a suggestion, please make that clear to us. Sure. So the way we are going to do this is that mics don't work in the back. For practical purposes, people who would like to make a suggestion or a question, we would like you to line up in the middle. And I'm going to first call on certain people to come to start the discussions first. Mr. Paneerselvam, Chief Executive, Meitei Startup. Sir, we couldn't hear you in the panel, but we would like your views. If you can come forward, please. And can a mic be organized for Mr. Paneerselvam, please? Mr. Ramprasad, thank you. In your back, sir. Yes, please.
Very good afternoon, and thank you, sir, for this opportunity. I'm the Chief Executive Officer of the Meitei Startup Hub from the Department of Electronics and IT, Government of India. We are an organization, the deep custodians of deep tech startups in the country, and we are very privileged to be part of this conversation. We would have loved to have more time, but 3 things that I would like to share as part of how we can make Andhra Pradesh. One of the things that we see in the startup ecosystem is essentially a lot of our startups are solving problems for the urban India, and they really don't know, or they are not really aware of the problem statements from the rural part of the. So one of the suggestions that I could suggest is have a problem statement repository by the government, organized by each ministry, centralized, where entrepreneurs, innovators and problem solvers can access these problem statements at a centralized place and pick up problems of their choice and start resolving them. I think that's something which is very, very important and critical. And the second aspect we have is a suggestion we have is we always look at there are only 2 customer segments for the startups. First is government, second is corporates. And government is doing their role, and corporates are, a lot of corporates are setting up their corporate accelerators, corporate innovation program. There's a successful program in the central government called IDEX, which is the Defense Innovation Organization, has been running for last 5 to 6 years. And there's a model that almost all ministries can replicate, because they put out problem statements. They have their, one of the mentors from the departments mentoring the startups, handholding the entire journey and taking them to a logical conclusion almost for about 2 to 2.5 years' time. And it is a very strategic program that is in nature. And that's a model that most ministries can replicate. And from the Department of Electronics and Meitei, I assure you we will be very happy to partner, and we will share the know-how how we can take it forward from the Andhra Pradesh government side. And the third and the important element is a lot of government focus on funding, which is essentially important, but the truth is there's more than money that we can give the startups, which is a procurement policy from the startup ecosystem from each of these departments. Because again, it's better to teach them how to fish rather than provide them with a fish. So it's kind of each department can set aside a certain percentage of procurement or from the policy in terms of that they can need to source this from the startup ecosystem. So these are the things that we really want to look at as suggestions from the startup side. From the Department of Electronics and IT, we are always there to support the government of Andhra Pradesh. And as a CEO of MSH, I'm very glad to see how we can. Andhra Pradesh has a great opportunity to kind of work with us, and we have the opportunity to work with them to kind of drive the startup ecosystem in the state, sir. So it'd be our pleasure to kind of again connect and maybe have a detailed discussion, sir. Thank you.
Thank you, Paneerselvam. CM Garu, one of the things which came in yesterday's roundtable was that many times startups and medtech people come with a solution looking for a problem. Can the government be very clear, saying these are our problem statements? For example, sir, the Dwakara groups that you started off, can they now move online? Can there be a virtual self-help group? If we can put those problem statements clearly there, I think that makes it easier for the startup world to interact. Over to you, sir.
As rightly mentioned by him, as on today, we are having some problems, but we want to create excellent ecosystem. That's why we brought so many policies now. One is innovation hubs. In innovation hubs, we made 5 zones, 5 innovation hubs. For example, Zone 1, Uttarandhra, 3 districts, Srikakulam, Visakhapatnam, Vizianagaram. Then Zone 2, that is East Godavari, West Godavari, Godavari districts. Zone 3, Guntur, Krishna districts. Zone 4, Prakasam, Nellore, Chittur. 5th zone is Anantapur, Kadapa, Kurnool. 5 zones we have created. We thought this is most viable. Then there will be central hub, that is Amravati, to supervise, to guide them properly, everything. Name also in name, Ratan Tata Innovation Hub. Here, as he rightly mentioned, one is a knowledge economy. And also our program is one family, one entrepreneur. This we wanted to make it reality. Then I have to create best organization for this total mentoring, venture capital, and how to identify everything in that regard. So we are also discussing with all of you. Ultimately, I told you morning also, as on today, some of the applications we are using. But so many applications we are not using as on today. Either knowledge economy or so many things. I can say how to encourage them continuously. We want to create 500 crores like that. Innovation hub, corpus fund, how to meet all these things. 5 zones, excellent industries who are all located in that zone. One top industry and also other industries present in their area will make it a body. Then academic institutions, these 5 zones, 5 areas we are having excellent academic institutions will integrate. Then we will bring venture capital. We need mentors. That is where other ecosystem also what all necessary will do it. Morning also I told very clearly knowledge economy, sky is the limit imagination. If you want to achieve all these things again, in knowledge economy data is available. As one example, just now my health secretary has given presentation. Ayushman Bharat, we are able to establish reasonably well. We can make it next level. That means 90%, 95%. Data is available. All this data, due to privacy, all these things will mask it, will put it before you. You come innovate ideas. Now Kuderu, one case study that is working. Some people have come with a pregnant lady, how to monitor. That is where our